Hi, I'm Freya from Expecting. If you're pregnant, you may be fully focused on the birth, but have you thought about afterwards? Who's going to cut the cord? Now, cords are weird and wonderful things. They're taking away all the waste from your baby and supplying the baby with all the nutrients that they need. And when a baby's born, we like to delay cord clamping. And that's because the cord is full of blood that actually belongs to the baby. So by delaying cord clamping, the baby's getting more oxygenated blood. Now, obviously in an emergency setting, that cord needs to be clamped and cut really quickly. But if everything goes to plan, there's usually no rush. So if you would like somebody else to cut the cord or even to cut it yourself, stop and think first of whether or not you're going to be squeamish. If you faint, you're going to be no help to the mom, the baby or the midwife. But if you do want to cut it, you can make it whatever you wish. You can make it separating mum and baby or cutting a bit of gristle. Now, amazingly, I frequently get asked about bringing in implements to actually cut that cord. This is usually due to the dad's profession or hobby. So it might be a blacksmith or a samurai sword fighter. And the hospitals will only really let you use their sterile scissors. So the cord, when you actually go to cut it, has had blood in it. Now, this doesn't mean that you need to cut it like this, but equally, I wouldn't cut it like this. And it's more like cutting bacon rind than it is cutting a ribbon. So it usually takes a couple of attempts to actually get through. Now, if you think of that cord stump, once it's been separated, like a ponytail. If you were to pull a pony, it would hurt, but if you were to move it, it wouldn't. So when you're cleaning it, just use cotton wool and water, give it a good clean and don't be afraid to actually move it. You then need to wait for it to fall off, and this normally happens on about day 5 to day 10. You're actually waiting for the cord stump to dry up and go kind of gangrenous and then fall off. When it does that, it can sometimes bleed, but only a little bit, and again, just use cotton wool and water to clean it. Only ever worry if it's smelling strange and then contact your GP. Once it falls off, then you know if your baby's got an innie or an outie. If you'd like more information about how to care for your baby and how to prepare for labour and birth, then check out expectingclasses.co.uk for a fully comprehensive antenatal course that's midwife hosted in your area or can be streamed online.